Hello everyone, welcome. Today, my name is Chris Carvalho. I'm one of the clinical leads at the CEG. We've got some of our team with us today. They'll be looking through the chat and answering some of your questions. We'll hopefully have some time at the end. I know that we have set this to be an hour and a half. I'm hoping we won't need that long, but there is a lot to get through. Good to see some familiar names coming in. Good to see some colleagues from across North East London here today. Welcome. Hopefully this will be really useful to help you understand more about reducing avoidable delays in diagnosis and helping you to work smarter in the Cancer Toolkit. So what are we going to cover? First thing is very briefly going to talk about who we are, but these slides will all be there with you afterwards. So if there's anything covered in here that is that we don't spend enough time going over and you want some clarity on, then we can share these with you afterwards, but also we give you some details of who to contact as well. We're going to talk about the service requirements and then go into the main aim of this talk today, which is talking about the toolkit. So let's quickly go through. Hopefully many of you are familiar with who we are, but we're a group of GPs, analysts and data scientists based at UL. It's a lovely picture of actually around the corner of where we work. But what we're really bringing to you some expertise around dashboards, searches, software tools. And one of the key things that we do is work collaboratively. We work collaboratively with your practices. We work collaboratively with our clinical leads across North East London, and that includes our clinical leads. In terms of the service requirements, you'll see there's two main parts to what you're being asked to do. There's QoF, which I think you're all pretty familiar with by now, and then there's also the network contract DES. And these are split up further. With QoF, you've got the cervical screening, and you've also got cancer reviews. With the network DES, you've got the impact and investment fund, and good to see many of you yesterday in our talk on some of the domains on the IIF. That has been recorded and that will be on the website. We've got another one on the 2nd of November covering some of the other areas. So hopefully you'll be able to see that and get some benefit from that as well. There's also around in the DES, the early cancer diagnosis part and tackling health inequalities. And moving back on. So what are we presenting today? This is the CEG Cancer Toolkit, and the aim is to help you meet those targets in those contracts, with also helping to work efficiently to clear some of the backlog, to review and reduce inequalities and referrals, and follow up in care by doing that reflective piece, and to simplify your safety netting. There are a number of different pieces to this pie. Some of it are new, some of which I have been around for a while, but this is packaging everything together to bring it into one to you. So if you look through that, there are support searches to help with the call and recall and help you to build your registers. There's a facilitation expertise through our facilitators, our primary care support officers, and our clinical leads. There's also some templates and protocols which are new, help with the safety netting for your referrals, investigation and monitoring, and that allows you to enter the correct code that you'll need to make sure you're doing that correct follow-up, also in terms of getting the contracts and the payments for that. There's also a dashboard that we have that will help you to monitor and compare screening performance. And one of the main things to talk about is the new cancer diagnosis audit tool, which allows you to audit your past referrals and reflect on the experiences there to avoid delays in diagnosis. Some of you will be familiar with See the Signs, and what this tool does is support every aspect of cancer care, fulfilling many of the functions of See the Signs. I'll leave that up there. That's mainly for reference, and similarly, the next page as well. Some of the things that See the Signs have done, and that we now have alternatives to help you with that. Now that See the Signs is no longer available, and this is particularly for those practices in BHR, Hawthorne Forest, and Newham. This really sets out those specific functions, what you can now use instead. This is mainly for information and go through this quite quickly, and we're going to share these slides afterwards so that you can see. So then one of the main things that we are presenting is the Cancer Diagnosis Audit tool. This was launched via email on the 3rd of October, and there is a request form on the CEG website. We'll share the link to the tool when we circulate the slides with that as well. So currently it's EMIS only in the system when it is in development. But what this aims to do is support GPs to reflect on those new cancer diagnoses and identify any problems, any avoidable delays that may have happened in that time. You can review by quarter. One of the benefits of this, like the other tools that we have, is that it works smartly or smarter to help with the filling of the tool, so it auto fills from the patient record. And one of the great benefits of this is it allows you to address inequalities by reflecting on those demographics and then spot areas for potential future focus. With the tools, you're probably familiar with the other ones that we have. That it's a simply you run the search in EMIS, you import the tool, the results into the tool. This autofills into certain sections within the tool from that patient record. You then need to complete the remaining fields as necessary, and then you can export an anonymized file for discussion. That's a very brief explainer of how to do the tool. But actually, there's more information in the user guide, and that's available on the website. But I'd also recommend in getting in contact with one of our facilitators. The details will be at the end. So it's not always easy for you to really see and understand how this works in a slide deck. So I'm going to hand over to Karishma to see the tool in action. I'll stop sharing my screen if you want to share yours.
Certainly. Thank you, Chris. Is everyone able to see my screen? Is that okay?
Yes.
Lovely. Thank you. Hi, everyone. My name is Karishma. I am a clinical facilitator with CEG, if you've not met me before. So as Chris has mentioned, the tool, if you downloaded it, it was accompanied with a very extensive step-by-step user guide. I'm not going to go through how to import patients. I'm just going to show you a couple of dummy runs and show you what your spreadsheet should look like in certain instances. So I'm going to start with importing my file. So that's assuming you've run your report, saved your report as a CSV file. So in the event that in a particular quarter you do not have any patient, you will get a message like this that says no patients fulfilled the search criteria, therefore EMIS report doesn't contain any patient. You'll click OK, and that will basically give you a line that says in that particular quarter no patient was found. So that is what you should expect to see should there be no patient return in that particular quarter that you've audited. I'm going to close that, and I'm going to bring up my tool again. So one of the good things about the tool is it's able to stack your results or your patient results, in the same sheet. So you could run your search one time. So we'll pretend we've run an audit in April. And you'll get a message that says data's been added and your latest patients have been added on the top. And that's me, run my audit, save my file, and I can come back to the same sheet the second quarter, the following quarter, and then import my later data. Again, same result or same prompt that your data has been added. So it will add your most recent quarter or your most recent audited period at the top. So Q4 for last year would be at the bottom, and then Q1 for the following year would be at the top. What you note here is the system has a clever way of identifying any patient that may have come into different quarters. Now, though the search and or the sort of it's set to look at 3 months retrospective data, but sometimes you could have double coding or duplication of codes, in terms of your cancer diagnosis. In those instances, you may find out your patients coming in a second in a second period. So the system will automatically highlight those patients in grey, as you can see here. So Mr. Fred appear or Mrs. Fred appeared in previous quarter and now is being flagged up as a potential recurrent diagnosis. We have this tick box here that will allow you to identify and automatically exclude. If you feel that's not the case and this patient should be part of the audit period, then you just need to untick it and you're going to have your patient included. All your fields in blue, so all your columns in blue are autofills. It will automatically pull up any coded entry. Anything after that will be things that you will need to fill in as clinicians carrying the audit. Bear in mind, we've formulated this in conjunction with your local cancer clinical leads, and it is in line with the early cancer diagnosis specs, where things like what tests were offered to the patient at the time of diagnosis or before diagnosis, and where they presented, how many appointments, things that are specified in the guidance have been included in this audit tool here. Any questions while using the tool, please feel free to let us know. On the tool itself, you've got our email addresses, and you've got the CEG feedback email address if you have got any feedback or any query. I'm going to stop sharing now. And I will let you take over, Chris.
Great, thank you very much. And back to me. So moving on, hopefully that was clear, but if you do have any further questions, it would be good to get in contact with the support team. I'd recommend downloading it, having a play, see how you get on, and work within your team to take that forward. Okay, so back to the pie chart. We've talked around the cancer diagnosis audit tool. One of the other things that's new is the cancer referral and safety netting. This has been developed in collaboration with our cancer leads across NEL. Some of whom are on the call today, and we'll bring them in after this slide deck and before any questions. But it's really is utilising expertise not only around cancer, but of being jobbing GPs and working at the front line of how to deliver great care for our patients and sharing information across. This works in a similar way to the EMIS Macmillan template, and I appreciate that some areas have been using that, very familiar with it. But the addition is that this case is in City and Hackney specifically for the local incentive scheme in that area. The tool, the template allows you to enter the correct codes into the record easily. I think anyone who's seen the range of which you can use, it's quite daunting. So we need to make sure we get the right ones to help you to work efficiently, and to also make sure that you are getting the right payments for your work as well. So we've made sure those have gone into the tool, the template correctly. And one of the key functions that allows you to add the diary entries for safety netting, whether that's for fast track referrals, for seeing or DNA in a clinic appointment, check and see if urgent investigations are back, doing active symptom monitoring, and any other monitoring and surveillance. This is available in Resource Publisher for EMIS, and one key message here is that you do need to activate the protocols to launch automatically, but that will be shared with you afterwards on how to do that. This is what it looks like. This is the template here. It has the similar logos that I think you're familiar with, and the relevant links as well. It gives you an idea of what the purpose of the template is. You've got your different pages on the left on fast track referrals, on admin, seeing DNA fast tracked, on urgent investigations, on the active monitoring, and the general surveillance. You'll see here there are tick boxes for the different fast track referrals and the dates that you would need to put into. So if you tick one of those boxes, you can then edit the date in there. You can see that was for earlier today, but you want to do that, you'd want to put in perhaps 2 weeks for the diary entry. If you type in 2W into that will add on 2 weeks onto the date that is in there. Just a quick note on that. If you do 2 weeks and decide, right, actually, no, I want to do 3 weeks, If you then put in 3 weeks onto the date that you've, after putting in 2 weeks, you're effectively doing 5 weeks. Because when you put 2 weeks in, it changes the date, and you are adding on the time onto that date. So just watch out for that little trick on there. Make sure you add the date that you have in there is the date that you want to add on the time to. This is the next page. This is the admin scene DNA fast track. You see hopefully some familiar codes in there. Allows you to monitor and track urgent cancer referrals and do the necessary. So you can record if the patient has attended their appointment and the date they were seen, or record if they did not attend the appointment. If the patient hasn't attended the appointment, you need to fast track. So you need to then record that you've done that follow-up and the date that that clinical letter was received, etc. Watch out for those things that have the double star, the double asterisks by them. This is then the urgent investigations. And so if you're doing an investigation for the fit test and you want to do follow-up, you can use this page and put in the date on there, and gives you some tick boxes to make sure that you've explained the importance of these tests as well. This section, as it says in the red there, is to actively monitor patients with symptoms at low risk, but no risk of having cancer. So you may wish to review these patients in an agreed time frame, and this allows you or supports you to be able to do that and monitor what you are doing there. And then the final of these is the monitoring surveillance, and this section prompts when you need those future investigations are needed. So you can say in there that this person is due a PSA follow-up based on the PSA monitoring in primary care, and you could put the dates in there to then follow it up. And there's also an area there for free text, so that the person is looking at that can see why it is that this needs to happen. So it gives you a bit more information around that. So with this tool, this has been published in all of NEL, and it's recommended to use in BHR, City County, and Waltham Forest, but we do know and appreciate that there is another option to use. So this is optional in Newham and Tower Hamlets for you to use, and many of you will be familiar with and happy using the existing EMIS safety netting template. You may have been using it for years, and if you've got your system set up, you're happy to use that. We're not saying to switch, but this is something that will be particularly useful in other areas, particularly City and Hackney, and other areas may want to use this given the support that we're able to provide through our facilitators and support officers, and also our clinical leads as well. So how does it work? So just to say, this template, it may be new to you, haven't seen it. So this was launched actually just yesterday, but it is available everywhere. So we just need to go on to Resource Publisher and look at that, and also then activate those protocols. So for those who are going to be using this template, and this is effectively how it works to with our protocols and searches to enable safety netting. And the template will launch automatically when you enter a fast track cancer referral code. If you add a buzzword that is coded, and that's a buzzword code, and there is a list of those that we will share with you as well. But if you enter that, then you will get a prompt to launch the template. So 2 ways to start on this, depending on when you've activated those protocols. And that will then launch the cancer referral and safety netting template, and you can add in the scene or DNA and the follow-up dates, and then you can run your searches afterwards on patients who are seen or who are DNA'd, and you can run your searches on those investigation results when they're due. Those 2 protocols you'll see in red need to be activated. Those are the ones that we're talking about, and also just remember to deactivate any old ones. If you're not familiar with how to do that, well, we're going to provide some information on how to do that afterwards, but also to link in with your facilitators in your local areas as well. I'll give you the details at the end on how to contact them. Right, support searches. These cover QOF, the PC and DES, and also obviously IIF. These are in both EMIS and System 1, and then there's CEG practice support folder. We'll show you where those are in a second. But high level, these are the cancer screening call recall with a focus on non-responders, SMI, and learning disability. There's the referrals, follow-up, and safety netting, which looks at DNAs, outstanding investigations, the FIT testing. Then there's the cancer care review and support discussion, and then prevalence improvement, probably maybe not the best phrase for it, but it allows you to improve your coding to make sure you've got the right people onto your cancer registries. These templates and searches, they all work together. So those practices using the EMIS McMillan template rather than the CEG one, you'll need to use the EMIS searches that correspond with that template. But have a look at this and see how it fits within the way that you are working within your practice as well, if you're already familiar with the other one. So where to find them? So most of these are in folder 5. You'll see in there in EMIS, this is what it will look like. They are now published in the practice support folders, and in folder 5 in EMIS and System 1, you'll find cancer safety netting, cancer screening call and recall, the cancer prevalence improvement, and the cancer support one as well. So just on that though, the cancer support is coming in System 1. That's not quite ready yet, it's in development, but it should be with you soon. But in there, again, folder 5, you'll find the tool there as well. Sorry, the search is there as well. There are some other searches in other folders. The bowel cancer non-responders are in folder 9, and then also currently in EMIS 1, and System 1 searches in development, but in folder 9 you'll see the bowel cancer screening non-responders searches as well. In folder 4 for both EMIS and System 1, you'll see the fit for lower GI referrals, which is IF CAN 01 indicator. You'll see these in there. These indicators are for guidance. As I was saying in the talk yesterday, we've taken the searches, the tools, sorry, the business rules, and interpreted them to give you an idea of how you are performing, so that you can see as a guide as to where you are and whether there's more work to be done. With these indicators where there is for payment, use these as a guide, but I would recommend overshooting the mark to make sure you achieve your payments wherever possible. So use these as a guide, but try and exceed those indicators, those targets, to make sure you are in a better place to be able to achieve the full financial payment. Okay, back to the pie. One of the other pieces of that is the dashboard. This is a visual representation of your current progress or your performance in this data, and particularly around bowel, breast, and cervical screening. Now, it allows you to view by practice, by PCN, by borough, or by the whole region. And this supports the way that we've worked over many years in CEG in looking at our data and looking at our performance, seeing where we are, where our peers are, and understanding from each other about how we can move forward and improve, and what we can do to get those numbers up. This is across Northeast London, so you'll be able to see everywhere in there, and it's both EMIS and System 1. You'll be able to get that through the dashboard link. Speak to your practice manager or your CEG facilitator for login details. Obviously, we want to make sure that you have access to it, but we don't want other people who may be using that as a performance metric to get their hands on this. But I think it's probably more useful to see the dashboard in action. So Karishma, are you presenting that again? I hand back over to you.
Thank you, Chris. So for those who have got access to our dashboard, as you know, it is on our main website, along with all our other dashboards. Our cancer screening dashboard was recently updated, and if anything, was published in Power BI, as opposed to the conventional Excel sheet, to allow for more usability. You will find the cancer screening dashboard at the very end of the main dashboard page, because it's a nail-wide dashboard. Going to click on it, it will load all your data. So you've got a cover page that will provide for refresher information on the different NHS screening programs. So that would be your cervical cancer screening program, your bowel cancer screening program, and your breast cancer screening program. Please note that our data source is your GP clinical system. That would be namely EMIS and System 1, and we use our code sets that are available on the NHS digital website. Like previously, we have our total population visual representation, so it caters for your different needs in a way. So if you're more of a visual learner, then you've got these pie charts to help you with identifying where you're standing at. If you're more of a number and table person, then you've got the same information in a table format. At the moment, you can see the nail-wide uptake for each of the cancer screening programs for each of the relevant time frame retrospectively. If you want to look at a particular locality, you just need to click on that locality. If you want to look at how your PCN's doing, if you're clinical director and you want to make sure that that's where you're standing, again, you can refresh your data to look at that. You can also see at a more practice level, and you can see where you've achieved or where you stand at. Again, the colors correspond to your achievement and non-achievement rates. Blue, namely for how much you've achieved, and pink for how much is left. Just different ways of representing the same information. You do have the same information in a more table format, and you have a further breakdown of all the patients that all the numbers that you need to know of. So how many eligible, how many numbers been screened, and what's the percentage. One thing that I'd like, so we have updated our dashboard to cater for the huge sort of for helping you to tackle health inequalities in learning disability groups and patients with serious mental health illness. We've also added homeless people for those who might be interested in looking at that too. So a couple of things that I'd like to show you with the dashboard. If you do not have an eligible, if you've got an eligible population but you've not screened anybody, you will get a 0% in your pie, in your donut chart. However, if you do not have any eligible population, then you will see a note to say blank. That means you don't have an eligible population for that particular screening group. And again, the same for these subgroups or underserved population. Our dashboard's updated every month. If you do want to go back to, seeing the whole nail information, then that will be, you just need to clear your filter. Back to on the cover page, again, you've got our feedback email address for any questions, queries that you may have. Please get in touch with us. We rely on you to let us know of any issues that you may encounter to update and keep our tool accurate. I think that will be it from myself. I'll hand back to you, Chris.
Thank you very much. One thing just to emphasize within this, we are really looking at services which will benefit our patients, but then also some of this is work which is incentivized where there are indicators through. We've spent a lot of time making sure that these match up because some are local, some are national, and so we need to make sure that those codes align. So if you use our templates, you'll see that the codes you put in there will mean that you are achieving the same indicators of performance for both the national and local contracts. So please have a look at those tools, the searches, the templates. Make sure you're using the right codes that are in those. If you have any queries on that matter at all, just let us know. We will get in contact and help you with using those tools. And making sure that you're doing the best you can in terms of achieving that incentivized performance. Okay, so what to do next? Hopefully that explains some high-level explanation of what the package does, the toolkit does, what the protocols do, and the different pieces of that pie. So download the tool, activate the protocols, deactivate the old ones, copy over the searches, that's folders 4, 5, and 9, to run those within your practice. Have a play around with the tool, have a play around with the dashboard, see how you think you can use it, and then get in touch if you need help. One of the key parts of that pie is the facilitation and expertise. So the team that we have are very experienced in terms of facilitation and supporting practices to achieve such good performance that we have done across NEL over the years in our different forms, but in terms of getting the best performance for our patients. And it's a huge credit to the team, who some of you can see in that photo, to help support you to understand how to use the tools we've developed and how to use the coding, the templates, searches, dashboards, to maximize that performance for you, for your patients, and obviously in terms of achieving that contract. So we offer practice visits that can be both online and in person. In that, there will be help using any of the CEG tools and resources, giving advice on specific topics, and also doing an orientation for any new starters that you have. So we've got we've got a great team of facilitators, support analysts, support officers, and analysts. Please get in touch. The details are here. So please get in contact. Hopefully you already know who your local contact is, but there may be some people who are attending today who are new, and we've also had some new additions to our team. So just as a reminder, and you'll get these slides afterwards of what their contact details are. We'll give some time for questions. I know you've been putting them into the chat, and our team, I have been answering some of them along the way. So I'll allow them to carry on with that. I'll allow you to please put more questions in, anything you're not sure of, anything you want to ask on. But also, can I invite, I think we've got some of our clinical leads here. Rob, I think Tanya, Helen are on the chat as well. I was wondering if you wanted to say a few words or comments on that from your perspective. Rob, hi.
Hi there. I don't think I've got much else to add, but just to say thanks for sharing. You're going to talk a bit more about the pop-up of the safety netting template when coding certain codes.
So let me go back on that. This is a refresher. So this is an outline. Did you want to add anything onto that, Rob?
Well, just to say that we've been looking at a list of buzzwords that might generate a pop-up of this safety netting template, and we're all aware of how annoying it can be to have a template pop up when you're trying to do a consultation. So we've tried to keep these buzzwords really the list as short as possible, so it's very clear-cut sort of cancer type worries like breast lump or unexplained weight loss, but we're aware there's lots of other codes that could represent a cancer, such as cough, abdominal pain, but there'll be a lot of patients we see with coughs and abdominal pain that we don't want to safety net. So hopefully just this template popping up will just change our practice a little bit so that we're safety netting more and more. I've run the tool that you talked about at the beginning, and very often some of the delays to a patient diagnosis from a clinician end is around inadequate safety netting. So hopefully some of this great work that you're doing will just change our practice a little bit so that we're safety netting more and more, and not missing these patients or losing them when they've presented, if they don't turn up for their tests, or if things go by the way, that we don't lose them. So, but very happy to hear any feedback from colleagues if there are things that we should change or things that are annoying.
Thanks, Rob. I think it's a good comment to make. Yeah, if there are things that we think we need to develop or take forward, like all of our tools at CEG, we do want to have feedback so we can make that work for you on the ground within your practices. And that also is a feedback loop that will help us then develop more things for you to help things work better as well. And that's really how this came about, is that that discussion between us and clinical leads as to what is happening, what needs to happen, what works within practices, and what can be done to help improve and take ideas that are working well in some areas out to the rest. One of the good things about using the buzzwords there is it's a little bit of a prompt to say, you've seen a patient who has a cough, do I need to think about cancer as well? But allows you then to think this is something which needs further thought and investigation. Okay.
Chris, we have one question from Vaishali, and I'm not sure if that would be more appropriate for you to answer. Or so the question is, do we need to, as part of the audit, complete the safety netting template after follow up with hospitals, diagnosis, etc., or will this update encode in EMIS as data flows through patient records?
So am I understanding that is to mean that do you as a practice need to update when they have had the follow-up afterwards? Is that the right question?
Yeah, sure. Do we have Vaishali? So
Sorry, thank you for asking my question. Yes, so what I meant was with the diagnoses which are being coded through various other means, will the template update, or do we need to then go back after audit to then manually kind of feed that information? And I'm thinking not, but I just wanted to be clear about it. Thank you. Thank you both.
So as I understand it, you will need to enter in from the record the details of that appointment and that follow-up. Then once you have put that in as a code of entry, when you do the tool, that will pull out from the search and enter it into the record. Now, if you then are doing that again after you've already completed it for it, then you would need to update that tool again with the next search.
Right. Thank you. That's very helpful. Thank you very much.
we have I'll let so we have another question about the dashboard dates. So have a date tab. That is something I can definitely answer. And the reason at the moment we don't have that is because we've modified so we've broken down the cervical screening subgroups. As if you've used the dashboard before, you'd know that the cervical screening group was just a group of women aged 25 to 64, but now we've broken it down to the two subgroups of 25 to 49 and 50 to 64. So we're just waiting on a few cumulative data before we can provide that to you and allow you to have a monthly progress of how your practice is doing. There's another question about deceased patients, so the cancer tool picking up deceased patient. And correct me if I'm wrong here, Chris, but because so the tool is a retrospective tool, analysis of your patients diagnosed with cancer and how you went about placing that coming to that diagnosis, in terms of the tests, the time frame, and etc. So your patient might have deceased afterward, but it's always good to include them in your audit to look at how you still went about the diagnosis. Is that correct, Chris?
Yes, absolutely right. It's a reflective tool as a piece to help improve the processes around the diagnosis. So learning from those who have unfortunately passed away will also be useful, regardless of whether that was because of the cancer diagnosis or otherwise. So this is more of a reflective understanding piece to help him with the improvement.
Tanya would like to come in. Tanya, please feel free to come in. We would love to hear from about you from a clinical or cancer lead perspective.
Thank you. I don't think my camera's working. Apologies. Can you hear me okay?
Yes, Tanya, please. Yes.
Thanks. I'm so sorry. So I'm Tanya. I'm the cancer lead for Tower Hamlets and have been in post for quite a long time. I just wanted to mention about the audit tool. So historically, we did this in town for quite a few years, and the feedback generally was really positive from the GPs. It was just to sort of mention that this tool would really fit the PCN-DES around the quality of the referrals we're doing and around early diagnosis. So one of the things I would encourage people to do is to share the results of the tool in terms of the reflections, both within your practice but also within your PCN. And more importantly, each area's got a cancer clinical lead, and we'd be really keen to hear if there are any systemic problems identified. That's not the purpose of the tool. The purpose of the tool is self-reflection and improvement. But if people do find that there are sort of thematic things coming through, for instance, a lot of the delays could have been avoided had something happened within the trust or there was diagnostic pathways problem, just a reminder to please use the cancer clinical leads as go-tos if you find you're coming across anything that you're concerned about. That was all really. Thanks, Karishma.
Thank you, Tanya. That's very helpful.
Thanks, Tanya. Obviously, yes, I think we would all want to know where things aren't working well to try and improve them, and that's one of the things that has led to some of the tools that we've developed and trying to fix problems. But like this tool, I think it's also important to celebrate things that have worked well. So if things have worked well in your practice, in your PCN, and that you would think maybe something that would be useful to share, I think we'd all want to hear about that, so that we can celebrate some of the good work as well, and then hopefully share out to other areas where that might be useful.
Yeah, I definitely echo that. Just one last thing for me is when we did this for about 3,000 to 4,000 patients over the years in Tower Hamlets, and what was really positive that only in about 30% of cases was there an avoidable delay. And we kind of hung on to that and forgot that for 70% of patients there wasn't an avoidable delay, as in it was an appropriate prompt referral. So I'd echo that. It is important to really look at what's going well and to share that as well. So thanks for reminding us.
Thanks, Tanya.
Thank you. We've got Joe. Joe, you've got your hand up.
Joe, I'm one of the senior facilitators from CEG, and apologies if you did mention this, I did come in a bit late, but just a couple of things with the cancer screening dashboard. There's two ways of accessing, actually. You can get that through the normal route of going onto the CEG website on the dashboards and have a look that way. But we're also putting it as a link in the templates. So you'll be able to just, by going into a template, you will actually be able to directly access it that way, because it's built in a slightly different way. It's built on what's called a Power BI platform, which means that we can now put those sort of links in templates. So that's just one thing really to alert you to. And the other thing was just about the recall searches with the diary entries. It's just, I suppose, again, it's the frequency of when you're running those searches, because of course what those searches will show you is they will show you the diary entries that haven't been completed. And also they'll show you the diary entries that will be coming up that are due. So it's your frequency of how often you run those searches. And just with the recall searches, just on the general surveillance ones, they may well be showing you patients who have got incomplete diary entries from, a few years ago, actually. So there might just be a little bit of tidying up within the practice that needs to get done there. So just those things to highlight.
Thanks, Joe. That's really helpful.
That makes sense.
Yeah, no, that does. Thank you. There's really good points there, particularly around that accessing the dashboard and the different options and the searches, etc. Thank you, Joe. Any other comments? I think we've still got some hands up.
Yeah, is that a new hand, Tanya?
Tanya, I can't hear you if it's okay.
Yeah. We've got a couple more questions, and I think one is about yesterday. So how do you extract data relating to referrals with FIT, as we could not fully understand the data we looked at yesterday?
How do you extract the data relating to referrals with FIT? I think this might be something we need to explore a bit more with you, Maurice, about the processes there, and perhaps then we'll understand the issues around that. So if we can get in contact with you afterwards to explore that in a bit more detail, I think that'd be useful. And if there are issues there, then we can send an update to the group afterwards and of any changes that we've made. But we'll be in touch afterwards to explore that in a bit more detail.
And we've got a question to say, how do we ensure that patients are part of this pathway, including providing leaflets and information?
So hopefully through the coding use and using the templates, that they will automatically be included. So there's a bit of a reminder to make sure that is completed. Within the referral forms, there is a tick box, a reminder to provide those leaflets with the links to the leaflets as well. So hopefully that is all included. Just want to double check. I think I don't think the links to the leaflets are in any of the templates, but that there are tick boxes to show that there are they have been advised as part of the processes in terms of the recall as well. So that should then be picked up when you run your searches. Hopefully that answers that question. Other
Thanks.
questions?
Janet Butcher will get in touch with you to help with accessing the dashboard, if that's okay. Yeah, I think that's all the questions we have.
Yeah, as Rob says, there are links into the patient info leaflets on the fast track referral forms, so please use those where possible. Okay, any other questions? We've still got a bit of time. I'm just going to go back across to the contact details and leave that up for the moment. So those are your support officers, your facilitators in your different areas. You'll see that we've got coverage across the whole of North East London. If you haven't made contact with them yet, and even if you don't have specific questions, it would be good maybe to touch base and let them know that you are around and that you are working on certain aspects of the contracts, the searches, what your roles are. It may be worthwhile then being in contact to go through some of the key things that we are doing, not just around cancer, but around immunizations, around IAF, around the contractual local contracts, and some of the national work as well. So there's a lot more that we are doing. It'd be good to maybe to make contact with the facilitators to explore more about what we're doing. Make sure you're getting the most out from that as well. As I said at the beginning, these well, this is being recorded. We're going to share this and the slides and the user guide afterwards. They'll have more information on how to use the tools, the searches, the templates, and what else you need to do. But as I say, if you need any more support, any more help, please get in contact with us. And can I just double check, Karishma, are we doing another one of these coming up soon?
Yes, so we will be doing a second one. I believe that we've set a date for November, but we will be letting you know and sharing out the invites for the second one. And if there is any updates, any feedback that we've worked upon, we will be sharing that in the second presentation as well.
Okay. There's a couple more questions, I think, coming through. Can you easily add patients onto safety netting that are sent for direct access diagnostics as part of NG12? Let me come back to the slide on that. Bear with a second. So you should be able to see the list of investigations. You've got your general surveillance, you've got your active monitoring, but you've also got your urgent investigations. So in there, you've got FIT, X-ray, ultrasound, CT, MRI, and then you've got your gasoscopy, colonoscopy, sigmoidoscopy, colposcopy, etc., etc. So for your direct access, then you've got that ability in there to send those through and do as part of the safety netting as well. Make sure you do tick on that box, the cancer safety netting at the top, and that you put in your dates as well for that follow-up as well. Okay. And I'll just come back to the slide at the end. That's your contacts. So for BHR, you've got Tracy, Billy Joe, and Ranjan, some of whom are in the chat today. If you want to, please get in contact with us and we can make contact to support some further. Any CPD certificates for this session? We don't have certificates, but please include that in your appraisals or your other work so that you've got a record of your learning from today. I'm sure as an appraiser, this would count. And on that note, I think that is everything. So hopefully that's been useful. As I say, we've got another session coming up. We are looking for more input and support. So happy to take more feedback on that, and we will hopefully get back to you with any other comments or developments. But alongside the slide deck, the user guide, and the video afterwards. Let me just say, in essence, yes, you can generate direct entries of actions, particularly around the follow-up as well. But we can go through that some more with you. Let's get you together with one of our facilitators as well. Okay, thank you all for your contributions today, your comments, your thoughts. Thank you very much to the Cancer leads for all the comments and feedback, to the team at CEG for working so hard on this tool, on the user guide, on the information provided. Thank you all for today, and we will see you soon.
Sorry, we do have one last question about when is the audit due. So the audit is, again, Chris, would you like to answer that? I don't know how to phrase it, but it's not required for any, under any sort of, there's no deadline, but you're recommended to do that under your early cancer diagnosis PCN DES service requirements, which would be an annual thing. Yeah. Thanks, Helen.
And I think Helen's onto that in the chat. Hopefully that explains it. And Rob as well.
Thank you.
Brilliant. It is useful for the early cancer diagnosis part of the DES, so to use that and to feedback within your PCN as well. Okay, can't see any other comments, but I think that's everything. So thank you all for today. We'll stop recording there, but we'll then be in touch. So thank you all very much, and we'll see you soon.